Alright, so I'm going to go over the cranial nerves. So, cranial nerve 1 coming through the ethmoid bone is located here. Cranial nerve 2, which is the optic nerve, is right here. You can see the optic chiasma. These aren't cranial nerves, but these are your internal carotids. Above those, you have cranial nerve 3, cranial nerve 4, this over here, this little string. Cranial nerve 5 is right here. 6 is behind that. 7 and 8 are coming through over here. And then 9, 10, and 11 coming through the jugular foramen. And cranial nerve 12 are down here. And you can see your vertebral arteries coming through the foramen magnum as well.
Next we'll talk about the cranial fossas. Up forward we have, or anterior here, we have the anterior cranial fossa. The sphenoid, the greater wing of the sphenoid, we have the middle cranial fossa. And then back here we have the posterior cranial fossa. The lining for the skull and the brain that we have is the same as everyone else. So we have two layers of dura mater, the periosteal dura mater, which is attached right to the bone, and then the meningeal dura mater, which would then lead to the arachnoid dura mater, and the pia mater would be covering directly over the brain. The subarachnoid space is where you would see cerebral spinal fluid. We can see up forward, or along the side of the temporal bone here, you can see the middle meningeal artery. It enters the brain through the foramen spinosum. Back kind of posterior, in the posterior fossa here, you can see the lateral transverse. And then the sphygmoidal sinus, which will drain into the the jugular foramen, and will actually lead directly into the internal jugular.
So next we have the arteries that supply the brain. This is one of the vertebral arteries. In Table 5's brain, there's no right vertebral artery, but it would be right here, and you'd be able to see that on other brains. The two vertebral arteries come together to form the basilar artery, and there are branches off of that supply the cerebellum. So the first one are these arteries right over here. They're called the posterior inferior cerebellum arteries. Then here, you're going to have the anterior inferior cerebellar arteries. These right here are your superior cerebellar arteries. So then the arteries that are up here supply the cerebrum. So this is your posterior cerebral artery. It's on this side as well. Right here and here are your middle cerebral arteries, and your posterior and middle cerebral arteries are connected by posterior communicating arteries. So you can't see them, but they would be right here connecting them. Then you have your anterior cerebral arteries, and there's a anterior communicating artery that connects those two as well.
And then we have the olfactory tract, the olfactory bulbs up here as well, and the mammillary bodies in here.
And then did we decide what other cranial nerves we can see? I know we can see
These are the
12,
hypoglossal,
right?
these little tiny ones on the stem, and then this was abducens.
For sure, those are the ones we know for sure, right?
That's what Dr. Wellen said.
Okay.
We can't differentiate between those.
Oh, and she also pointed out the pyramids, right?
Yes.
Oh, yeah.
And then the olive of the medulla. I'm not sure what that is, but these are your pyramidal tracts. And then we just have to do these because she said she'll definitely use this brain for the ventricles. So you can see here, and I'll use this one. These are your lateral ventricles, and what separates them is the septal pellucidum. And over here you can kind of see the interventricular foramen connecting the lateral ventricles to the third ventricle, which you can see the beginning of it right in here. So that's it.